Hey everybody, this is Dr. Chris Nelson, and today I wanted to talk to you about an interesting topic. It is a bridge versus an implant bridge versus a removable metal framework partial. So let's get right into it. This particular patient is a wonderful person. They are reluctant to get any dental care at all, but they're missing 3 teeth on the left side, and everything looks pretty good except the patient, even though they don't want to get dental work, they want to know their options between having those 3 teeth replaced with a long span bridge that's tooth-borne, so it's permanently attached, or 2 dental implants and a 3-unit dental bridge, or 2 dental implants and a 3-unit implant bridge, or something removable, which in our case we would recommend a metal framework removable partial. So I have some other videos on these similar topics that you can take a look at, but for this particular patient we wanted to walk through the pros and cons of each option and lay a groundwork for making a good decision on what the patient really wants. And it might be where the patient decides to do nothing and just leave it as a space. They've been wearing nothing, they've had the teeth missing, since they were extracted, and the patient has essentially been fine with having the missing teeth. They're not complaining about it, but since we are onboarding the patient as a new patient, they want to know the options for possibly replacing the teeth in the future. So we're going to swing over to the computer and we're going to take a look at options for this patient. Let's take a look. So here we go. We have our patient and they have these missing teeth right here. This patient does have their wisdom teeth, so that's something to consider. When we do new patient exams, we look at everything very thoroughly, and in this particular patient you can see that they have a couple things going on, but mostly for this video we're just talking about the upper left missing teeth. And I want to go back to this picture because you can see that the lower teeth have not super erupted. So they are, maybe a little bit. You can see this one's up a little bit higher, but there's a lot of space right here. There's a lot of restorative space, which is a good thing. That gives the patient a lot of options for restoring the teeth. There are a ton of times where patients have 1 or 2 or 3 or 4 missing teeth, and it's been like that for long enough where the opposing teeth have actually started to move up. They've orthodontically extruded or just naturally extruded over time, and all of a sudden patient says, hey, can I get a something to replace those teeth, an implant, a bridge, a partial, whatever, and there's no space for it. So in order to make the space, we have to actually move the teeth. We have to intrude them. Sometimes that involves braces with wires. A lot of times that involves a referral to one of our orthodontist partners. So in this particular case, you can see that there's quite a bit of restorative space. If you can just imagine these teeth, there's room for more. So that's great. And if we look at the x-rays, I've actually drawn a couple implants in there, and what you can see is there's actually a lot of bone right here. This line right here is probably a sinus floor. You can see it over here, and so if we were to put an implant in this back section, the patient probably would need a sinus lift. That's between the patient and the surgeon, but I like to prompt our patients and say, hey, in this scenario, here's where the sinus is. I'll draw approximate implants and say, see how this is right there? We might need to do a sinus lift at the time of the surgery. For our surgeon partners, they're pros. It's not a big deal to do a sinus lift or a sinus augmentation, bone graft, and place an implant. Sometimes those surgeries have to be separated where the sinus lift and bone graft is performed. It's let to heal, and then the implants are placed later. That's, again, between the patient and the surgeon. So, what do we do about this? Well, to replace 12, 13, and 14, if we wanted to do a fixed bridge, let's talk about fixed bridge. Fixed bridges are awesome. Before the era of dental implants, that was a really, really nice way to replace missing teeth. And in this particular case, we would have to, or we would be encouraged to do something called double abutting, or a double abutment on this particular case, because there's this law called Ante's law, which references root surface area and how long you can make a span of a bridge without having a higher failure rate. Let's just make this really plain. If you have 3 teeth and you're hanging 3 teeth off of 2 teeth, the fake teeth are winning. There are more fake teeth than real teeth, and that can be a problem for the real teeth. All right, so if we wanted to do a bridge, and we wanted to bridge from here, and we'd want to go like this, and like that, and like this, and go to here, that's a long span bridge, and it's more predictable in this particular case to possibly include this tooth as well. So that would be a double abutment. The other ways you could double abut the molars, it depends. You got to look at the occlusion. You need to maybe talk with your lab and talk with the patient and figure out their expectations. But a lot of cases, we would actually do several anchor teeth, like in this case, maybe 3 anchor teeth to replace 3 missing teeth. Now, that brings up the discussion point that, hey, we are doing a lot of drilling on teeth that are in really good shape overall. So do we want to do a long span bridge? Patient might say yes, but that's another thing to consider. Also, you can get cavities typically right here, right here, right here, and right here under the bridge if you don't floss it properly. So we design the bridges so that they can be cleaned under reliably, but in this particular case, if you don't take care of it, it's going to be a major problem. So let's step back and think about, well, what if we wanted to replace the missing teeth with implants? Okay, so I already kind of drew those in there, but the implants would go up in the jawbone, up here, okay? And then there would be a cover screw here and a cover screw here. And then after the implants have healed, there would be a 3-unit bridge from there, there, and there, like this, okay? So that particular solution is probably more common because in this case, we don't have to damage the adjacent teeth by drilling on them to make bridge abutments. So I think a 3-unit implant bridge would be really nice for this patient. We wouldn't have to change the other teeth, and it would be great. It is the most expensive option, so that's something the patient needs to be prepared for and okay with. But a 3-unit implant bridge would be an awesome option if the budget supports it and if they want to do surgery. The other part is they can floss in between the teeth. That's awesome. And they do have to floss under the bridge, but they're not going to get cavities on the bridge. They could get bone loss, but they're not going to get tooth decay under the bridge, but they could get it on the adjacent teeth. But in this scenario, they can floss between the bridge and the adjacent teeth, and we're not prepping the lateral. Okay, the last scenario is, so if the patient wants to do a removable metal framework partial, we have to design it so that the partial will stay in place. And if we're looking at that, there's going to be the metal partial, and then there's going to be some acrylic, some plastic teeth on top. So the plastic teeth are going to come out, and the pink acrylic will be like this. It'll also extend over here a little bit, and then there will be teeth on top of that. So the teeth will be right here, and right here, okay? And then there's going to be a metal framework, and the metal framework will probably have a rest right here, and then probably another rest right here, possibly another one right here, possibly a clasp that runs around the tooth, and then there'll be a framework that comes along And a lot of times we have the framework come all the way over here. There might be another rest right here. There could be a rest up here. It kind of depends on your lab, and also there could also be one back here, or we'll wrap it all the way around the back tooth. Now this patient has wisdom teeth, so that's a little bit tricky of a scenario, but bottom line is you're going to have a framework that extends over and covers the part of the palate. Now these frameworks are really, really thin. They're like jewelry, and so they're highly tolerable. Patients that have them, they really like them. That framework, if your teeth don't move, can last many, many years. The teeth over here will wear out over time, but the framework itself is super durable. So that's something to think about if you want a removable option. These rests I'm talking about, typically we have to drill a depression into the tooth so the metal can sit into it, so your the opposing teeth aren't hitting it really hard. So that's another thing to consider. But for patients that want a removable option that is not an implant, it's not a long span bridge, a metal framework partial is a great option. Another solution is a plastic stay plate. I have a separate video on plastic stay plates versus metal framework partials, so you should check that out if you're considering removable options. But overall for this patient, I think we've kind of run through the pros and the cons and some real world scenarios for this particular case, and I just want to let and I just wanted to let you know about those as options. So if you have any questions, let me know in the comments below. If you're in the Redding, California area and you want to connect and learn more about me or our team, go ahead and find our website, www.nelsonfamily.dental. We also have a denture specific website. It's www.denture.doctor. So you can check those out. And I hope you've learned something, and I hope you have a great day. I hope everyone's really nice to you all day, and you make someone's day better too with your smile. Take care.